Lake Research Partners.
Medicare for all is Medicare for none.
One Republican take on Medicare for all from Senator Bill Cassidy of Louisiana. He's been one of the leading Republican voices on the issue of health care.
You're going to put 150 million people, deprive them of their employer-sponsored insurance into Medicare and a trust fund which is already under duress, and a projection that doubling individual and corporate taxes would not be adequate to cover the increased financial burden.
He was, of course, the Cassidy in the failed Graham-Cassidy bill to repeal and replace the ACA. I asked him to explain how he thinks his party should be addressing this urgent voter concern.
We should address it by saying that the patient should have the power, that too much of our system is aligned to serve everybody but the patient, and because that is the situation, and a lot of that is because of Obamacare, because of that situation, premiums have skyrocketed and taxpayer payouts have dramatically increased, and at the same time, there are record profits for insurance companies and hospitals and pharmaceuticals. We need to change that dynamic so that the patient has the power, not these other entities.
So what about a system whereby an individual can, and I've heard a lot of politicians talking about this, buy into Medicare, something we've long ago called a public option that says I can buy into private health insurance, I can buy into Medicare, whichever one works best for me as a patient and my individual needs.
The only way it's a deal is if it's actuarially sound. It turns out most people get far more from Medicare than they actually pay in. Okay, and if you include the Medicare Part D, taxpayers pay 2/3 of the drug benefit for somebody who is on Medicare Part D. Now, if we continue to have taxpayers pay 2/3 of the drug benefit and somebody buys in, well, of course, everybody's going to be on Medicare because they're getting this incredible subsidy on the drug benefit. And so Medicare for all will be Medicare for none.
One option that you presented last year, the so-called Graham-Cassidy, or we can call it Cassidy-Graham, would give the power to the states, right? Basically, you're saying, here's a pot of money, state fill in the blank, you do with it what you would like. Can you explain how this would work, and why would that help ensure that a patient is getting the care they need for the cost they can afford?
That particular plan would have taken the amount of money the state would receive had they expanded Medicaid and those who are on the individual exchanges. It was patterned after the Children's Health Insurance Program, the CHIP program, which was originally conceived of as a block grant and is wildly popular. People on both sides of the aisle praise the CHIP program and work to make sure that it's reauthorized. I think we recently reauthorized it for like 10 years, I believe. And what we have found is that if you align incentives for the states, this is the pot of money that you get. States are very wise in terms of how they administer that money. It isn't so much a lobbyist coming and saying, hey, listen, I want a sweetheart deal. The state says, we just got a certain amount of money. We can't pay more. And so therefore, in our budget, this is what we will pay you. This is exactly what businesses do.
Though that would mean that if I live in one state, my ability to get certain health needs met may be different than if I lived in another state.
No, if you look at the CHIP program, the CHIP program has very definite measurements as to what benefits must be offered. Now, it can vary between states, and that you're technically right. But Amy, have you ever heard anybody complain about their schedule of benefits on CHIP? I never have. I'm a doctor that worked in a hospital for the uninsured and for the CHIP and Medicaid patients. I never heard anybody complain about the CHIP. The politicians on both sides of the aisle that praise CHIP, you never hear them criticizing the lack of offerings. They don't. And so we deliberately patterned it after this, hoping that people would have a level of comfort as to the schedule of benefits that CHIP programs provide.
How would this program, though, really do the thing that you talked about at the very top, which is to ensure that the lobbyists aren't getting a big cut of this? Because aren't they still going to try to come in and make sure that they are somehow involved in this process? It's not as if state governments don't have lobbyists crawling all over their capitals.
Totally. I'm a physician. I know that. Like I said, I worked in a hospital for the uninsured for 30 years, or something like that. It seems like 30, 25, 30. Once you have a fixed budget, that kind of straightens things out. The dynamic in a state legislature is that the federal government is paying at least, in Louisiana, 65% of the bill. In some states, like Mississippi, it might be 80% of the bill. And so all we're doing when we pass fill in the blank, the special deal for a certain industry, is we're passing that bill to the federal taxpayer. Now, as it turns out, the state is still on the hook for 20% in Mississippi, 35% in Louisiana. You pick it's 50% in New York. And so even though the federal taxpayer is paying a large sum, maybe even the majority, it still cannibalizes other spending within the state. I like to say it becomes like a narcotic. You think it's free money, but it's not free money. Eventually, it starts taking from other parts of the state budget, so there's less money spent on secondary education, less money spent on public colleges, less money spent on roads and bridges, as more shifts to Medicaid.
Let's say that in 2019, Republicans keep a hold of their majority in the House. What's your expectation for what happens with Obamacare and the next step?
I say that health care is something that we cannot ignore, and that whichever party is in charge, I would just hope that we could work together for a bipartisan solution that would address this. I'm right now working with members of the other side of the aisle, Democrats, on a price transparency bill. And we're getting cooperation. There's 6 of us working together. I have something on my website, Making Healthcare Affordable Again, cassidy.senate.gov. Would love comments from the general public. But how do we lower the cost of healthcare? If you can lower the cost of healthcare, you can lower premiums that way. You can preserve the life of Medicare. One more thing about that is not a partisan issue. We can do that independently of our discussions about Obamacare, and hopefully that'll give us a starting point to work not from a partisan perspective, but on behalf of the patient.
That was Senator Bill Cassidy of Louisiana.
The takeaway is supported by legal